Our act actually mandates us to rescue, rehabilitate every victim of human trafficking. So we are under this compulsion to first and foremost protect the victims of human trafficking by offering them a safe haven, which we are providing in our shelters, that has counselors that are well trained in the management of every case, especially trauma-centered cases in the agency. So it's an open policy, and it is open for everybody to be able to access. The team actually went around the homes where the shelters are, working with FCT, and I can tell you that I have not seen the reports, but at least for the homes that are visited, they actually met the minimum standard, because that's why we have this research. It's a research-based finding, and then it's coming out today, where you can all assess what the report is and see how far they've been able to comply with the minimum standards as enshrined in the world of best practice.
Ever since they started this work, they have always been consulting us, whether online and offline, and we've also looked through some documentations. All we want to know is that what are the protective aspects for victims of human trafficking and forced migrants. We know that when people when they go through issues, they become traumatized. So what are those things you have to do? And if they are not available, what are the things you do, like referral? So it's good like NAPTIP is here and UN Women sponsoring this kind of a audit report. I think one of the things we are proud of is the inclusiveness in everything. We don't think that is a particular gender that is susceptible to this. All gender, whether everyone, whether children or boys or girls, they are susceptible to this, and we are happy that inclusiveness is what we are taking into cognizance today.
This project has been on since April last year. The idea is that we want to prevent trafficking of women and girls in Nigeria, and also to engender a gender policy environment in the country around the issues of human trafficking, forced migration of women and girls. So within this scope, we did gender audits of protection homes, both in Lagos and Edo states that are the project states, but at the insistence of NAPTIP at the headquarters, we approached again that let's do a similar exercise for the FCT. And essentially what you see today is the outcome of that process. So in terms of findings, what we have seen is, number one, when you talk about shelters, they are heavily concentrated within the Amak area. So what it means is that places like Abaji, Kwali and all of that, you have less shelters that cater to the needs of survivors of human trafficking and forced migration. There's also the issue of gender disaggregated data. So people just come in and they are just documented. You know, you don't have that consciousness to say, okay, how many men are coming in, how many women are coming in. Although some shelters are still trying to play some roles by providing some minimum basics for women who are trafficked and have been brought back and all that. But overall, there is that gap that is showing that we need to do more, both for the private providers and also to government entities. Clearly, again, there's a need for coordination. So all the shelters visited, and including those of the government, people are sort of working in silos, but there's no coordination. So we need to have a sense of how we are responding in terms of providing or protecting or preventing human trafficking of women and girls in particular. So it's this gender audit that throws light into what we have done on the field, and it's a stakeholder. It went through a process of wide stakeholder engagement at the level of developing the tool that goes to the field and also validating it, and then in going to the field, coming back, bringing the stakeholders together to say, this is what we saw, can you validate it? So we went through that entire process, and what you see today is publicly unveiling, this report. So in going forward, one of the suggestions is that the national referral mechanism, it's a very important document. We need to constantly refer to what that document says on how, when survivors come into our shelters, what do we need to do?